What are the committee's recommendations for caffeine consumption? So essentially, we want to have caffeine be an implemented uh, protocol within hospital systems, starting off in the greater Columbus area. But in order to get there, we believe that some sort of implementation plan or some sort of framework should be established first uh, in order to gather a larger sample size. So, for instance, one of the ways we could do that is using the Iowa-based practice model, which would essentially help transition our research findings that we do in the field or that we presented in this presentation, and hopefully using those findings and utilizing them into clinical practice. And starting off in the greater Columbus area would be a great first step. And the Iowa-based model is a really good model because it essentially breaks down the clinical process down into 5 steps, which is assessing or developing a question, deciding and looking at what has worked in other places, and then collecting the data, seeing that if a change is really needed in the hospital system, implementing that change, and then evaluating that change to see whether it worked. So I guess that would be one of the strategies that we would use in order to determine whether or not if the caffeine consumption is really working. Going back to some of the strategies to strengthen this recommendation, I think it's important to look at what were the limitations of this research because there were quite a few. First off, there are many sources of caffeine intake, and for instance, this study only looked at coffee and tea, but I'm sure you know there are several hundreds, thousands beyond my perception of foods that contain caffeine. Therefore, there's already a limitation regarding our generalization to the findings, whether or not what sources of caffeine are truly the ones that are preventing cognitive disorders. Second, it was hard to evaluate amounts of caffeine intake in each study. So, for instance, many people drink varying amounts of coffee. One person might drink 1 cup, and another might drink five in a morning or within a day. And because of that, that makes uh, studying, if caffeine really has an influence on cognition, is there a set amount that needs to be established when moving forward? And we believe that's one of the things that they need to do. While caffeine can range from between 70 to 220 milligrams, even the type of coffee bean and preparation methods are different. So moving forward, I think, or we believe that the recommendation should be to create some sort of standard where all the variables are controlled. So, for instance, controlling the amount of milligrams of caffeine intake for a day, or controlling what type of coffee bean and preparation method are used. And even within tea itself, tea is going to be typically, classified into 3 types according to the degrees of fermentation. Black tea, oolong tea, and green tea. One's fermented, one's not. And those could have effects on the long-term development of cognitive diseases. In terms of the study designs, we noticed, even though a lot of our studies that we utilized were meta-analyses or systematic reviews, uh, a lot of the articles that they were reviewing were either testing, uh, or were merely surveys or volunteers that joined a lot of these groups. And we believe that one of the recommendations that we could go or use moving forward is trying to utilize some sort of randomized controlled trial and pulling away from those surveys. And based on some of the information that I mentioned before, that I understand that that's a very difficult thing to do, especially when you already can't control uh, like the type of coffee bean, how much coffee. But regardless, we believe that if some sort of randomized controlled trial were to be implemented on a wide scale, say Columbus or Ohio, um, that this evidence could provide more insight into the clinical problem at hand. In terms of the sample characteristics, this made our answering our PICO question quite difficult because age was not really considered, or age was not considered at all in almost all the studies that we looked at. And this could be is problematic because one of the things that our PICO question was looking at was how do we, in the long term, uh, use caffeine consumption to uh, prevent cognitive disorders in the elderly. And that question was difficult because, while we know that caffeine may produce this antioxidant effect and regulate amyloid precursors, amyloid B proteins, um, that that wasn't really looked at in age-specific populations. So moving forward, when we're looking at uh, sample characteristics, having or if we can somehow use age and control age, I believe that'll help researchers in the future determine whether or not age seems to have a factor in whether or not caffeine consumption is successful. And in terms of interventions that could be done in the future, we believe that baselines need to be first established within a certain population. And some of the tools that they can do or use in order to determine that baseline is a clinical dimension scale, mini mental status exams, and MRI scans to really measure baseline cognitive function, which I believe would provide a good base to which researchers can then uh, uh, begin studies. And another intervention that could be done as well is drawing plasma caffeine levels. And this would provide a more reliable measure of caffeine versus self-report and surveys, which in the most part was the main self-report and surveys were the main component to many of the studies that we saw. So if the studies and the future studies were to utilize some sort of plasma caffeine level draws and to be able to use tools like the mini mental status exams, MRI scans, we believe that the level of evidence uh, and the type of interventions used would be the reliability and validity of them would be increased greatly. And hopefully, once these strategies to strengthen this recommendation are implemented, the dissemination of results through the Iowa-based model will be finished. And hopefully this new research will look beyond the age limit that we established and continue to find novel ways to tackle dementia and Alzheimer's. Thank you.